So, all right, great. So let me just say okay. And so welcome, Pam, and welcome to our group. So this is the Alliance for Addiction Solutions. So Ms. Pam McKee is trained in microcurrent neurofeedback. Her background is in nutrition and somatic work. She trained under Dr. Amy Apigian. I think you all might know her. She does a lot of work around trauma. And so Pam did a couple of her courses, and that's where she was introduced to neurofeedback. And the microcurrent neurofeedback is using smaller amounts of current, almost like homeopathic version of using supplements. So I think she calls it the homeopathic version of neurofeedback. So she's also currently training with Christina Veselak with the Academy of Addiction, and is also implementing amino acid therapy. So in general, neurofeedback is a form of biofeedback that uses electrical potentials in the brain to reinforce certain desired brain states. And it's also using EEG or electroencephalography as a feedback. All right, I'll let Pam speak more about what she does exactly. And all right, Pam, and you can introduce yourself if I've missed anything.
Okay. I think you covered everything, but my name is Pam McKee, and I do work with neurofeedback, the microcurrent. So I'm going to just start sharing my screen here. See that full screen? So this is on the benefits of microcurrent neurofeedback for mental health and addiction. And there's a lot of different modalities that we help as far as emotional and physical problems. So today we're going to talk about the microcurrent neurofeedback and how it's beneficial in many things, but especially in mental health and addiction. So you see the second slide there now? Okay.
Yes.
So there are many avenues that we use to help our clients, pharmaceuticals, nutraceuticals, and electroceuticals. I personally don't use pharmaceuticals, but they're all necessary at the right time and place. So many people feel like people who work with biofeedback or neurofeedback, they don't believe in pharmaceuticals, but I believe there's a place for all of these at the right place. So there are many styles of neurofeedback. Neurofeedback has been around for decades. The older tradition, and that's not what this presentation is about, but I'm going to touch on it. It used operant conditioning to train the brain. And that's like teaching a dog to sit. It uses a reward system. It also used more leads than we use. It uses a style of mapping that is a little more complicated, and it took more time. They had to send it out to get results. And some still use this, but this is not what we use. We use microcurrent. That's the other form. It's also known as LENS, which is low energy neurofeedback system. And that's during this presentation, I might refer to LENS or MCN, microcurrent neurofeedback. So MCN is a branch that came from LENS. And the history of it is from Mr. Lynn Oakes, who originally developed the LENS system. He was a psychologist. And in the 1960s, he was part of a core group working with biofeedback. Then in the 70s and 80s, neurofeedback was brought in. And then in 1990, Lynn Oakes worked on a simpler system, the LENS, much simpler. There's no active participation in this as it was in the traditional, and it's a type of self-regulation. So what exactly is that? It gathers and mirrors. Basically, the sensors are picking up real-time electrical activity. So we have neurons all over our body, and whatever we do fires neurons, like lifting our arm or turning our head or crying or tensing our muscles, etc. So then the system is picking that up and it's mirroring it back to the nervous system. So the person's own physiology is driving the feedback. So the body recognizes it as self. It just is very comfortable with it. So the process then basically is that small sensors put on around the head monitor the brain waves to send electronic signals to a computer and EEG processor. The computer returns a tiny microcurrent signal back to your brain that mirrors your own brain waves. The microcurrent produces a fluctuation in your brain waves, which allows a gentle, effortless release of fixed, frozen patterns. So the body lays down a new neural pathway, increasing neuroplasticity. That's what we're going for. This allows the brain and nervous system's chemical balance to self-regulate. So this is a quote from Lynn Oakes that I really appreciated. He wrote the foreword in the book by Stephen Larson, The Healing Power of Neurofeedback, great book. He said, "The current equipment uses electromagnetic fields weaker than existing radio waves in the air around us to convey the feedback to the brain. It leaves nothing in the body as opposed to other things. No electric current is involved." So MCN, microcurrent neurofeedback, and lens uses the principle of hormesis, less is more. And Valsa mentioned that in the introduction. So many of you may be familiar with homeopathy. Some confuse this form of treatment as the same as naturopathic or herbal medicine, but homeopathy it's different than just basic nutrients or herbs in that it uses the principle of hormesis. And that is like MCN and lens. They use that principle. So the end result is it activates the glymphatic system. It restores abnormally slow delta waves. It promotes metabolic clearance. It increases neurotransmitter pathways, and it balances the parasympathetic and sympathetic system. So to get more specific, it interrupts the dysfunctional patterns that the physiology has acquired as a result of bumps on the head, physical and emotional trauma, birth trauma, anoxic events, environmental influences like toxicity that we get exposed to, and chemotherapy, and much more. So even as far back as in utero or birth traumas, this may have caused dysfunctional patterns. So almost everyone can be helped to some extent with neurofeedback, but it isn't a cure-all. We never claim that, and it won't fix a broken arm. It won't cure cancer, but it has been seen to help greatly with the issues that come from cancer treatments. So who can be helped? Well, just about anyone, infants to elderly, people with anxiety, depression, TBI, autism, ADD, ADHD, animals, all kinds of animals, even giraffes have been treated. And optimal performance seekers, that's another avenue that many of my colleagues have taken, that doctors and lawyers come in before big cases or important surgeries to help that prefrontal cortex work better. And of course, when the nervous system is relaxed, everything works better. And so you've seen the picture before of the young child being treated. They're sometimes even easier to work on because their nervous system hasn't been tweaked for so long. The young lady that you saw on the slide before came in, she was 3 when she came in the first time. She had nightmares, terrible nightmares, and it was just one treatment and everything was back to normal. So usually these little ones that come in after they've had a treatment, they're anxious to come back in again. They like sitting in the chair. They can't tell you why, but they want to get back and have a treatment. So what else? Of course, we're interested, and you guys are, in addictions and dependencies. So these are the things that it helps with these. It helps the cravings for alcohol. And that is also, it also helps with the need for self-medication because it's helping treating anxiety and depression and other suicidal thoughts that sometimes drive people to want the substance abuse. It also changes patterns, which we'll talk a little bit about. and it can actually change the taste of alcohol to people. We've had incidences that people report. One woman specifically, she reported that she was upset. She came in to get help with anxiety and depression, but she enjoyed her glass of wine in the evening, and she was upset because her wine started tasting differently, and it wasn't tasting so good anymore to her. And she wanted to know why. What did these treatments do? And so we explained to her, you know, it changes patterns. So it could be that the pathway of that tasting of alcohol could have changed back to how alcohol tastes when we first tasted it the first time. Sometimes it doesn't taste so wonderful. So that was just kind of interesting, showing that it actually does change the taste of alcohol to some people. So therefore, the microcurrent neurofeedback calms the addiction centers in their brain. Thus, it helps to avoid addictive behaviors. So what else can it help? So this is, let me just click, this is a link. Let me just bring this up a little bigger. This is a paper that Mr. Oakes wrote that lists all the things that he basically used his lens for: the cognition, mood, motor, motivation, anxiety, reactivity, pain, dependencies and addictions, fatigue, and performance optimization. And I have this paper. If anyone wants a copy of it, I'm happy to send it to Balsa, but it goes into the diagnostic areas, the underlying functional problems. And it's just nice to have an overall view of what the lens and the MCN does. So a little bit about the glymphatic system. So the lymphatic system that we're familiar with in the body is the same as the glymphatic system in the brain. And it's the part of the brain's waste removal system. So this helps keep the neurons healthy when the glymphatic system is healthy. And that's the other thing, like you saw in the previous slide, it helps the glymphatic system be stimulated. So this, I'm sure you guys have seen this before. This is axonal damage that we see. And when this occurs from trauma, physical and emotional, bumps on the head, etc., and this may give us an impaired glymphatic system by this axonal damage. So when we can help and stimulate the glymphatic system, axonal damage can repair and regenerate. Now, it was thought in the past that this wasn't possible, but we know now that that isn't true, and we'll talk a little bit more about that. This here is MEG brain images pre and post neurofeedback treatments. You can see quite a variety of different things happening with these 6 participants, but it definitely changes over time and clears out that inflammation. And that's the other thing that cleaning out the glymphatic system helps with, as far as getting the inflammation down. This was part of a study that was done that, if anyone's interested, and I can give you links to, that has these MEG images. So then what's really happening? It's creating the environment for the brain to heal by restoring balance to the brain and the nervous system. So it increases GABA, serotonin, endorphins, dopamine. It's decreasing homocysteine, adrenaline, cortisol, etc. And then it's performing neuroregulation. So that brings us to neuroplasticity. That's related. So it's the ability of the brain to reorganize itself, both in structure and how it functions. Scientists used to believe that the brain was hardwired. We used to think that after childhood, you could not repair, regenerate, or replace damaged brain cells. But now we know the brain can change. It can change its structure based on how we use it, the structure of the brain and the nutrition we provide. So neurogenesis, new synapse, strengthened synapse, weakened synapse. These are all the things that we know now will happen over time in the right situations. Continuing generation of new neurons, new skills and experience create new neuronal connections, Then, of course, we can strengthen it by using those connections, and then we can weaken it by not using it. So we know now that that is the way it works. So this paper was something that I just took a portion of. This came from the Institute of Psychology of Eating, but I think it applies to all the things that we do. Healing happens in a relaxation response. So more specifically, the majority of our maintenance, repair, and transformation of body tissue happens when we're in the physiological relaxation phase, otherwise known as parasympathetic nervous system dominance. And that is exactly what we are accomplishing with neurofeedback, bringing the body into the parasympathetic state. So another thing that we like to look at is suppression. We all know what suppression is: holding down, not letting things happen. So suppression compromises function. So the central nervous system is unable to reboot following an insult when things are suppressed. So LENS and MCN helps restore compromised or lost functioning. Many times during or after a session, a client will report that old memories are starting to surface, ones that they really don't want to surface. But when they do surface, it's not devastating to them as it was before. So they're able to deal with maybe what happened without falling apart. Not always. Sometimes we suggest that they, have a psychiatrist or a counselor on board, but sometimes not. Sometimes they're able to actually work through it. So this is showing that when we continue to relax the AAS, this also strengthens it. And this is exactly what Mr. Oakes and Mr. Larson in his book documented. And they continue to remind people that when we relax the nervous system continually, it strengthens it. So it restores function, restoration. So it restores balance to the brain, body, physiology, and nervous system. It removes the blocks which interfere with higher functioning. So it seems sometimes to even restore the blocks to who we really are. Sometimes people, when they're suppressed or blocked, they lose some parts of themselves that they aren't able to express. So sometimes it can bring back that. This is just a few quotes that people have given us about how they feel after their series of treatments. This is Janie. She says, after just 4 treatments, I feel a calmness within. An unexpected benefit is the clarity of my mind, the positive thoughts that flow, the feel good inside. I don't feel the anxiety that normally consumed me. So we hear very many different things from different people. It affects everybody different. Not everybody feels like they got a happy pill, but some people do. Not everybody feels like, wow, I'm so relaxed, but many do. So it really affects everyone a little bit differently. So this next client, he was an old cowboy and he was a roper, and he had abused his body ridiculously. So when we first treated him on his very first treatment, we asked him if he had any body pain, because we always ask that. And he basically listed every main part of his body: his shoulders, his knees, his elbows, everything hurt. He said it hurts most of the time. So after the first treatment, and we didn't do a body treatment, which I'll get into that, what a body treatment is, but we only did just the brain treatment. He stood up out of the chair and he said, nothing hurts, like nothing hurts right now. But of course that didn't last, because it was just the first treatment, but it was quite a testimony to see what can happen in certain situations. So over time, he did a series of treatments, and of course things did last longer and it did help. It's not a cure-all, but it was a big help. And of course, his quote here is, "My mind has cleared a lot. I can go out to the garage and remember why I went there. Unexpected benefits were not experiencing the pain in my shoulders and back, and my balance has improved." So this is after he did, a full series of treatments. So this brings us to body treatment. So we are mostly working on the brain, but sometimes we go down and work on the body. And of course, it's connected because we're working at the top of that vagus nerve. And though MCN is primarily for the brain, it does help with the central nervous system, so it can help the body. Not always, again, I reiterate that, but it is connected. So sometimes we get reports of relief in the body pain when we do that, especially in the neck and shoulders, because that's usually where we go. So this next guy here, this is what happened to him. And this is actually isn't a picture of my husband, but this is what happened to him. So he's 65. He's been on horses all of his life. He still rides most every day, though he's not really a bronc rider. He's a calm, safe rider. But last year, something really unexpected happened, and his horse threw him really hard. And he remembers being on his back afterwards, and all the guys in the arena were just standing around him wanting to know if they should call 911. He had kind of lost his air. But of course, you know, he wouldn't do that. So he came home that night and he said that every bone in his body hurt. So I gave him a treatment, brain treatment first. We always treat the brain first. And then we did a body treatment. And he woke up the next day and he said, all my pain's gone. I wasn't really sure I could believe him, but I did over time because I could see that he was not hurting, and it really did clear it. Now, that doesn't happen all the time, but I did see it happen this time. And a lot of the times when we can treat something really close afterwards, it can stop that nervous system from reacting. This is a quote from True Wave Psychology in an article on exploring microcurrent neurofeedback. And they say MCN reduces emotional and physiological responses associated with traumatic memories and PTSD. So by training the brain to produce more balanced brainwave patterns, it can help individuals experiencing reduced anxiety and improved mood. And then this is a quote from the clinical advisor.com that MCN facilitates detoxification within the brain, again, connecting with that lymphatic system. So this is a measuring device that we use. Not everyone uses it. This is not really part of the MCN, but I just want to let you know this is what we use to measure. It's called the brain gauge. It's a cognitive assessment tool that measures brain health by testing sensory perceptions at the fingertips. There's many different types of measuring devices that are out there that different practitioners use. Some are auditory, some are optical. We've seen some of the research on this, and this is, if you want to learn more about this is corticalmetrics.com. If anybody wants more information, see the testing on it. But it tests these main things: speed, focus, fatigue, accuracy, sequencing, timing perception, plasticity, and connectivity. And it's also used just to assess these neurological conditions: concussion, neurodevelopment disorders, substance abuse, migraines and chronic pain, pharmacological manipulations, aging, and degenerative disorders. So this is what it looks like when we get a reading. This is a day 1, 6, and 14 post-concussion, but this is what we do. We will take a reading before we ever do a treatment, and then we'll continue to do readings or tests, they're called, maybe 6 or 8 treatments in, then again, maybe 12 or 14 treatments in. And even though we usually do not see this bad on our first treatments, but sometimes they're close, they're more like between here and here, we always see improvement after MCN treatments. And that's kind of what we want to track. And we want to see that part of those parts of the brain are starting to engage. And this is just the graph, or a different way of viewing this. This is the same as this. So that's just kind of what we use to kind of track to see what's happening. So these are just a few reports that we have had from others that have used MCN that are dealing with addictions. One said, I can function as a normal person. Another one said that our cravings are very diminished. And some say that I feel much calmer, so my need to indulge passes. So those are just a few quotes that we've had. You know, the system that we use, the microcurrent, envelops the whole brain, as you saw in the picture of the young girl with the leads here. They're around the brain. Other lens providers and different lens systems may go into different parts of the brain. They can read more specific things. I'm doing a simpler system that just envelops the whole brain, and when it does that, then other things that I may not like, I can go into certain areas of the brain that I know may be in need of more function. But when we envelop the whole brain, we get other great responses of things that we didn't know that maybe weren't reported in the initial report. So that's that type of system I use. So in conclusion, MCN is extremely helpful in mental health and addiction. It helps relax the CNS and ANS along with strengthening it. So it allows the brain to regenerate and restore healthier neural pathways, and it's safe and effective, and it's have never found any contraindications with it. So any questions?
Yeah, thanks, Pam, for presentation. I have a few questions, and I know there were a couple of questions that came in the chat. So when an individual, how does an individual find like a lens that they need a lens treatment? Is it usually word of mouth? Like someone has had this experience and so they refer their friends, or how do people find out about it?
I have never really advertised much. When I first started a couple years ago, it was all by word of mouth, and it kind of blows up from there because people feel so good, or they're changing, and people are asking, what are you doing? Why are you able to come out in public? You know, et cetera, et cetera. So mostly word of mouth, but sometimes people will hear it from a provider or from someone who doesn't live in the same area. So almost all of the main systems have websites that you can go in and find a provider in your area.
And how does it work? So in terms of the actual like mechanism of someone comes, sort of, they say, okay, I have something wrong. Do they usually say I have pain, or do they usually say that I have an addiction, or is it mental health, like brain health? Like how much of each grouping do you get? Like body health, body pain versus mental health versus addiction? And I'm separating the two, even though it's the same.
I mean, what percentage of each do you think I see? Is that what you're?
Yeah, in
I would
general, like
people don't usually come to me for body pain. The only time they come is because they know that it has helped other people. The majority of people are coming to me for emotional support, much smaller for the addiction and dependencies, because I don't advertise it. It's not really my expertise, even though I am working more with it with the amino. But I still have people walk in my door that they may be suicidal or panic attacks. And then within our intake form, we find out that they have some type of substance abuse. And it can even be substance abuse that is prescription based, that they have not used their prescriptions the way that they were told to use them. They're self-medicating that way too. So we have a quite extensive intake form that asks, a million questions. And then as we go through that, we ask more questions. And sometimes we don't find out everything until after maybe a treatment. And it's kind of like when many times people go and they say they talk to their beautician. Well, when we start working on their head, they sometimes tell us more and we find out more. So, but the majority of people are coming for emotional support, and the other things kind of come afterwards.
So they come in, you do an assessment form. Do you do an assessment? You said, are you putting a cap on? Because that girl just had a couple of leads. So it's so what do you do with the hair? Like you just sort of part the hair to put the leads in?
Yep.
Okay.
Mm-hmm.
So
Yep.
it's straight.
So
And it,
yeah, they go all around, and some in on the head. When we start, because of the microcurrent and the whole theory, we start with the least amount. We don't want to overstim. And that sometimes is what has happened in the past with the older systems. They get what they call overstim, and they might get like a headache. They might get an exasperation of symptoms, which still can happen with someone who has a very sensitive nervous system. That's why we do as much assessment as we possibly can to assess how vulnerable their nervous system is. So we start really light, but as we go through the series of treatments, sometimes we stay light the whole time and we get great benefits but sometimes we move forward into stronger protocols, and we move into different parts of the head that are somewhat more specific, like for anger or for heavy depression. There are certain areas that is more in the hair, and yep, we just part the hair and stick the lead in there and prep it so that they get our machines show if we have a connection, because it's such a microcurrent. We have to make sure we have a connection.
do you start at 20? It's hertz, right? That we talk where we like
Picowatts. We're at picowatts.
watts. So you talk about watts rather than hertz. Okay. So you start at picowatts and then
You know, some people call it hertz. We're like in the system I have, we're like, from 0 to 10 in the different protocols. But many times they're talking in picowatts, like 3 picowatts is kind of the starting average.
okay. And then you might increase it. And I know you said in your presentation, like one person got 4 treatments, felt great. Is that the average number of treatments most people get before? When do they feel better? Like, is there is it
Oh,
like after 2 treatments they feel better, so they come back for more and more? Or is it like, do they have to stay with you for, say, 5 treatments before you can say it's not working for you? Or
that is the most common question I have. I should have put a slide in for that. How many treatments will it take? We never know. But with most adults, in order for it to hold, it's going to be 12 to 15 to 20 treatments for it to hold. So with the microcurrent, 85% of the people that come in feel something, feel a good effect on their very first treatment. But then there's another 5% who don't feel it for 2 treatments, another 10% maybe that don't feel it for 3 treatments. But I've never had anyone that after 3 or 4 treatments didn't feel something. Let me take that back. There's been about 3 people over the hundreds and hundreds of microcurrent treatments that I've done that didn't get benefits. These are the things that will stop us from like, yeah, I don't think this is going to work for you. They were on so many pharmaceuticals that they couldn't even tell what was happening. And that will sometimes block progress. Not completely. They were actually getting benefits because their partner was telling me, oh yeah, she's changing, but they didn't really want to change. So that's another thing. People who don't want to get better won't admit that things are happening, or someone who says, I don't believe in this. It's like they just will sit there and but my wife says I have to do it, so I'm going to sit here and I'm going to do it. And it's like that, they just block it. I mean, and even the partners will say, I notice the difference, but if they don't want it, they don't need it. Does that answer
so I'm
that
going to go to,
question?
yeah, thank you. So I'm going to go to the chat. And so in the chat is your website, www.thebraingym.com. That's Pam's website. And just wanted to remind everyone that our next presentation is on June 26th. We're going to have Dr. Umhao talk about alcohol use disorder, the medications for alcohol use disorder. And so the first question is about dementia, the use of microcurrent for dementia patients.
Mm-hmm. Yes, I have used it. And it's different with everyone, and it really depends on how far the dementia is. If the dementia is really advanced, and there's already parts of the brain that have died, it will help, but it's not going to bring it back. Again, it's not cure-all, but if it's at the beginning and family members are starting to notice it at a very early stage, then it definitely can help. So yes, does that answer the question?
If whoever wants to follow through with that question. Yeah, okay. Hey, Eileen, how are you? All right, so, okay, so let me just go back to the chat. Oh, what was the brain gauge website? What was it called?
Corticalmetrics.com. You want me to put it in there?
Yeah, sure. Someone asked about the website for the brain gauge. Can anyone go into that website and
Yes,
do
in
their
fact, he has a bunch of YouTube recordings on his YouTube channel. There's probably a link there, but yes, you can listen to a lot of different explanations of that device on his YouTube channel. And another, I don't know if this, sorry, I didn't mean to interrupt. Go ahead.
I was just going to ask, is it a device or is it just an online questionnaire that you do?
No, it's a device. Let's see, where's mine at? It looks like a mouse. And these are the tactical devices that you use your fingers, and that it vibrates or vibrates in different sequences and different which one's stronger, which one came first, and it goes through all these different things. And it takes anywhere from 10 to 20 minutes, depending upon what testings that you're testing. I test for everything, so it usually takes 20 minutes.
So it's for testing, right? And then the intervention, that device doesn't do anything about addressing the issues that show up.
It's just measuring which parts of the brain are working better than others. And then in the research, once you learn about which parts aren't, which one's affected by focus, which parts of the brain are affected by sequentialing, those are the things that, then you'll know I may go into a different part of the brain and stimulate that a little bit.
Okay. But that's so like if, like say I as a general public go in and buy this device, what would it do for me? Like, why would I want to buy it? Like,
many people use it for different reasons. They use it to strengthen their brain because within the cortical metrics program, there's actually brain training with this. And I send these home with clients and say, okay, now after we do a few treatments, I said, okay, now see these areas that your brain isn't firing as good. Now go in and do some brain training. And so they'll use it for that also. But mostly I basically am using it to see what the microcurrent is doing and how it's helping in the long term on things. But it can be used for both.
so there's another question about, you mentioned alcohol addiction. Has this approach been used for other addictions, specifically cocaine?
I can't say that I personally have used I haven't had any clients with cocaine, but I know it has been. So the addictions, whether it be cocaine, alcohol, benzos, whatever it is, affects the same parts of the brain in that way of wanting something for self-medication, whether it be for I want to have it for more focus, or it's still changing those neural pathways to relax things down, to not have the craving so hard. It's not a cure-all. The client has to try themselves. They have to be willing to, they're trying. They have to be in a state that they want to help themselves. They need to, whether they're pulling themselves out of their environmental causes, etc. But it's definitely a big help.
And for those who are interested, there's the amino acids like tyrosine usually helps with cocaine addiction, because the deficit with cocaine use or amphetamine use is of the dopamine, norepinephrine, the catecholamine system. So tyrosine can help with that. So that's using amino acids to try to improve some of these neurotransmitters. And so
Yeah,
another
and that's exactly what we're doing. We're using both here. We're doing the amino acids with the microcurrent, and it's a great, they work great together. I'm real happy with being able to relax things and then feed the brain at the same time with the tyrosine and the different amino acids that are depleted from the different addictions.
And Christina Veselak has her website. It's called aminoacidtherapy.com. We'll put it on in the chat, and there you can learn about amino acids. And she has a couple of community sessions that's open to everyone. If anyone wants to learn more about amino acids and addictions, you can go to her website where she has these open sessions that people can learn more about amino acids. So we'll put that in the chat. Okay, so it's called aminoacidtherapy.com. And if someone has experience or interest, you can actually also do her course. All right, so the next question is, have you had any success with chronic conditions like long COVID or chronic fatigue?
I have not worked with chronic fatigue, but I have worked with conditions that are very close to chronic fatigue. And again, that I feel like the combination of the amino acids and the MCN is really helpful. This woman wasn't diagnosed with chronic fatigue, but I highly suspected it. And we did a lot of body treatments. And we usually only do the body treatment right here, and it affects the whole body. But sometimes with people who have such strong body pains, we'll go down the body into a little bit longer sessions. And so I feel like it definitely helped her. So I can't imagine it doesn't help, but it was in conjunction with the amino acids. I see the one about withdrawing from antidepressants.
Yeah.
So yes, we have worked a lot with that, and I am really happy with the way it works. But again, it's with the amino acid help, because the we've seen two ways that it has helped. In fact, I mean, two ways that it worked. In one way where the client was given the withdrawal formula way too fast. You know, we've kind of talked about that balsa in our amino classes, but they withdraw too fast, and then they just want to get back on them because it's too fast and they can't handle it. But with the help of the MCN treatment, sometimes we have to up the treatments when they're starting to with going through withdrawal. We have to do them more often because their system isn't ready for it. But then we did have a client who did titrate back correctly and got it off really slow. And she was so happy. She sent me a text that said, it has been 10 years since I've been able to be without antidepressants, and I'm so happy. But it was because she titrated back correctly, and she added in the amino acids correctly, and she upped her microcurrent treatments at the time she was titrating back.
So, yeah, in general, for anyone who's trying to come off of any psychotropic medications, be it SSRIs or any psychotropics, it should be done very, very slowly, like less than 2.5%, 5%, not like 25% like the conventional doctors might advise. And in general, it's also good to let your practitioner know that you're tapering off. And then I agree, you need to have support. The foundational things that you need to do when you're trying to come off of psychotropic or mental health medications is a good diet that includes a lot of amino acids and maybe avoiding gluten and dairy and sugars. And then some of the movement part of it, whether it's going for a walk, earthing, some kind of movement. And then amino acids is definitely part of it because you want to try to help your brain make the neurotransmitters that are needed. And of course, we need to have some sort of like what Pam was talking about, microcurrent neurofeedback. And I'm actually incorporating that into what I do when I taper individuals off of medications. I think that was the last of the questions. Does anyone want to open up your mic and want to ask question directly to Pam? Anyone interested in asking any more questions? Go ahead. Go ahead, Ms.
Hi, I'm Kathy. I don't know why it has my husband's name on there. Are there, like I live in Cincinnati, are there practitioners all over the place? Is there some kind of association that I could look and try to find someone near me?
That's a good question. So I have only been associated with two different systems, the LENS and the MCN, but I know there are, when I just Google neurofeedback, all kinds of different types of systems come in. There is a neurofeedback organization that I am not part of. So if you just Google neurofeedback in my area, things come up. And since so I try not to promote one company. I'm trying not to do that in this presentation because there are so many different companies, and they are all of benefit in some way. So I don't want to say this one's the best, this one is the way you should go, because I don't feel like that would be correct. You know, especially from learning from even the professor that designed the brain gauge. He was really informative in saying that just all kinds of nutraceuticals are helpful. In fact, I don't know if you've ever seen the research years ago that talked about beekeepers. Beekeepers live longer. Have you ever seen that research on that? They always wonder, why do beekeepers live longer? And then there came up, and I wasn't able to find the slide. I was trying to find it, but I couldn't. But people used to lay their heads on beehives to get rid of headaches and to make themselves feel better. And so if you Google that whole thing, bees create a vibration. There's like a electrical charge of some type, not like this, but in a sense. So why did people lay their heads on beehives? And why do beehive people live longer? You know, we don't know, but there's something to it. So the idea that I was trying to put across is that all electroceuticals and electrical stimulation in small doses helps. You know, when it's too much, then it can overdose and it can overstimulate and cause problems. And that's what old traditional sometimes did. And even some in the wrong hands can overstimulate. So it can all help.
Yeah, so in the conventional world, they use something called ECT, which is a lot, right? It's using very high amount of electricity or power. And there, as Pam was saying, there are many different companies. There's FSM, there's BCIAA, there are many different kinds of companies, and there are different mechanisms, right? Like some people use video for feedback, you know, using video as feedback. Then there's biofeedback. So there are different kinds of, I guess, modalities that companies or institutions might use to try to modify the brain, because the brain is mostly electricity, right? So that's what it is, because you have electric, the way messages are transmitted is electrical messages across a nerve, and between nerves you have these chemical messengers called neurotransmitters. So it's basically electricity. That's how messages are transmitted, like the brain, the heart. Those are the most common ones that we think of. And so that's why you can use different kinds of ways of modulating these messaging, the trafficking of messages. And so that's why you have different companies. They might have a little different philosophy. They might have different protocols. And so you just have to be aware that there are different kinds, and in your area you might want to investigate, like, what do they have in my area? How effective are they? And so usually it's oftentimes it's like a franchise. So you have your local practitioner and they're connected to a bigger practice, a bigger group. So that's how you would investigate and just make sure that and sometimes there might be a minimum number of sessions you have to sign on to versus, you just pay as you go and just see how you do. Did I say that right, Pam? Would you say
Yeah,
anything different?
that's basically it. Yes. And most everyone will let you pay as you go, but you're always going to pay more. And that's kind of because most neurofeedback wants to encourage a series. And that was the other thing I probably didn't finish explaining is that when you do a treatment on the first one and we're starting really low, we're not expecting it to last long. Sometimes they may not even feel it, like that 15% may not feel it, but something's happening and it might last for an hour and it might last for a day, or they might be a late reactor. I've had some clients who right at 48 hours, like, whoop, I felt it at 48 hours, but it won't last in the first treatment. So every treatment is a cumulative, just like our stresses are cumulative. So the more treatments we have, the longer the benefits last, and we're building on that. And so that's why, as a normal adult that has been in a trauma situation or been holding trauma or addiction for a while, then it takes longer. Like a child, I could do 1 or 2 sessions and they're good to go until they watch a bad movie again or something, but with an adult that has had something for a long time, it might take 12, 30 sessions, depending upon how deep it is and how long, but because we want that treatment to start holding, what we call holding and lasting. So our idea is that we don't want you to keep coming back forever. You don't need to do this the rest of your life. We want to start resetting those neurotransmitters. And as long as those people are taking care of themselves nutritionally and doing some good nutraceuticals, they can hold. If they don't, if they just want to go and not really take care of themselves, they might be coming back for longer. Does that make sense?
Sorry, I just have someone at the door, but I have one more question. Can you use this for panic or for fear-based problems? And I'll be right back.
Absolutely. Absolutely. In fact, fear and anger kind of go together in the same area of the brain, and it definitely helps. I worked with one who went through a bad relationship situation, and it took a little while until we could start, getting to those areas of the brain, because we don't want to just like go there and stimulate it. So we kind of let the brain get used to the electroceuticals, get it to calm down, and then we can go into that area of the brain that works with fear and panic. And just relaxing that nervous system and strengthening at the same time helps the panic attacks subside. Most people, after they've had, I don't know, 3 to 5 to 6 sessions, they're already seeing their anxiety come down and the panic attacks either shortening or lessening between incidences or just subsiding.
So I don't know if someone else has a question, but I know we have a couple of minutes, but I have a patient who has fear of walking, like because she's had like trauma and like she fell a couple of times and now she has a fear of walking. So do you think this would help her, like going in for some sort of neurofeedback?
Yes, exactly. Because basically that's that stuck blockage of that fear of something. So those who, like, we've had clients who fear flying or fear of being around certain people. And they find that after they've gone through, more like a little further into the treatments, they can feel that panic and that fear subsiding.
Anyone else with questions that you would like to ask Pam? All right, so it's right at 3 o'clock. Anything else, Pam, that you'd like to talk about? I mean, you want to talk about your website?
Not really.
Okay, so anyway, she's
Like-
available in Colorado. So if you guys would like, and please join us next month for a presentation on medications for alcohol use disorder. Dr. Umha will be here. And then we have a presentation later on neurotransmitters, urinary neurotransmitter testing. That's in August. So we have presentations every month. So we welcome you to join us, and please go on our website. Please see if you'd like to be members. You have access to some of these recordings. We have a lot of recordings from the past also that you would have access to. So we
Looks
hope
like
to
there
see
was
you.
one more question. Where am I located? I'm located in Colorado in a very small town called Rifle, like the gun. I'm on the western side of
Oh, okay.
Colorado.
There's one more
It-
question. I have Fisher-Wallace cranial stimulator. Are you
Oh.
familiar with the device?
I am an FSM, which is very. I'm sorry. What is FSM?
No, it's a Fisher-Wallace device. Fisher-Wallace cranial device stimulator.
I'm not oh,
It's
that was
easy to say.
Mary Leland. I'm a Fisher-Wallace cranial. No, I'm not familiar with the Fisher-Wallace cranial. And then the other one was I'm an FSM practitioner, which is very different. So, and I'm not familiar with that either. I have seen these different devices, but I have not used them and I'm not trained in them.
Actually, I know about FSM. I've sent patients to FSM, and so I know a bit about it. If that was a question. All right, guys, it's 3:01. So thank you so much, Pam, for joining us. This was awesome. Thanks for your time.
You're welcome. It was nice being with you guys. Thank you, Balsa.
All right, you're welcome. Thank you again.
Thank you, Pam.
You're welcome. Thank you.
Thanks.
Thank you all for being here.